Good evening and welcome. I'm Vincent Makori and this is Africa 54. First today, the World Health Organization says it is possible to obtain zero Ebola cases by the end of 2015. Speaking in Geneva Wednesday, WHO Assistant Director General Dr. Bruce Aylward said it is the World Health Organization's goal to attain zero transmission in the human population by end of 2015. However, he cautioned that governments in the region cannot be complacent and move on to other issues just because there is no new case of Ebola reported, but there must be vigilance.
How do we make sure that the international community doesn't pack up and leave when we hit zero, and that we don't have that continued capacities that are going to be needed? I think it's a real threat, or I think it's a real risk, and it's a risk that has got to be managed. I think it's fully manageable. If you've got your survivor registries, if you're screening your survivors, it's all about helping make sure people know their status.
Well, the WHO report comes as 3 more people have tested positive for Ebola from the same village in Sierra Leone's northern Kambia district, where a 67-year-old woman died last week from the virus. The latest outbreak temporarily dashed the country's hopes of being declared Ebola-free following the release from the hospital late last month of the country's last known Ebola patient. Sierra Leone has had nearly 14,000 cases of Ebola and about 4,000 deaths since the outbreak began in 2015.